Okay, I'm performing hand hygiene and having privacy. Hello, my name is Elena. I'll be your nurse today. How are you doing? Patients state they are fine. Okay, so today we're just going to look over your eyes, ears, and your sinuses today. Just to make sure everything's intact. It should take about 3 to 5 minutes. Is that okay? And patients state that it is fine. All right. So today I just wanted to start off by asking your name and date of birth, and looking at the ID band. The patient states the correct name and date of birth. Okay. Do you have any pain or any allergies? The patients state they don't have any pain or any allergies. Okay, so today I'm just going to be inspecting, and then I'm going to be assessing certain areas. So is that okay with you? Patients state that is fine. Okay. All right. So um, at this time, I will perform the Snellen test, and the patient will pass with 20/20 vision, so that is normal. And then I'm also going to inspect the external ocular structure. So as I'm looking, I don't see any discharges, any lesions, any bruising or redness. Um, the patient eye color is brown, and it's appropriate to the patient. Um, um, the eyelashes and the eyebrows have normal distribution of hair. The eyebrows is even with the and symmetrical with the face. Okay, and so now I just wanted to inspect the conjunctiva and sclera. So I'm going to pull this down, and I'm just going to ask you to look up. And so when I look at the conjunctiva, I see that it's pink and moist, and the sclera is white. Okay, and so now we're going to perform the corneal test. So I'm just going to shine a light in your eye. So just look straight for me. And I shine a light in this eye, and I see that the other one constricts, so that it's normal. I'm going to shine a light in the other one, and the other eye constricts, so that it's normal. Okay, so now I'm going to do the wagon wheel test, or the 6 cardinal test. So I'm just going to move my pen light. I just ask that you keep your face straight and forward, and just follow the pen light with your eyes. So I'm going to be moving out and inward, and I'm going to be moving clockwise, and I see that the patient has no proptosis, no nystagmus, or strabismus. Okay, good. And I'm just going to move the pen light inward, so just follow it with your eyes again. Okay, thank you. And so I note that the patient's pupils is round, is even, and they react to light and pass the accommodation test. Okay. And so now, and the EOM is intact. Okay, so now I'm just going to move to the ears. I'm just going to inspect the outside of the ears, look behind them, see if I see any bruises or lesions, and I don't see any of that. Any disformities, I don't see any of that. The ears is symmetrical with the face, so that is good. Okay, and then they are intact, and the ear color is appropriate to the skin color of the face, so that is normal. Okay, and so now I just want to palpate the ears, and wanted to talk about the Weber and the Rhines test. So, and then we would use a tuning fork for that. So the Weber test is just to see if they can hear in each ear bilaterally, and then the Rhines test is for the ratio is 2 to 1 for the air conduction is to the bone conduction of the ear, so that is normal. And as I'm palpating the ears, are you in any pain with the ears? Patients state they are in no pain, so that is good. Okay. And so now I'm going to assess your hearing loss. So I'm just going to whisper two words in your ear, and then you just state the words back. They stated the correct words. Okay, and patient states the correct words. All right, and so now I'm going to palpate your sinuses. So I'm just going to touch your face. So I want to palpate the frontal sinuses. Any pain? Patient stay there in no pain. Okay. And the maxillary sinuses. Any pain? Patient stay there in no pain. And I'm just going to use my pen light for the transillumination. And I see that the nasal airway is bright red, so I don't see any blockage. So that is good. Um, so I don't know any tenderness with any of the sinuses that I've inspected. So I just want to reassess your pain. Are you in any pain? Patient stayed there in no pain. Okay, anything I can get for you? And patient stayed there fine. Okay, I just want to thank you for your time today. At this time, I will lower the bed and bring up the bed rails, and I will bring the call light. If you need me, just press the call light button. All right, and thank you for your time. Hand hygiene.